Today, the skill that we're going to be introducing is prone positioning and draping. So for today, the equipment that we need is 4 pillows for positioning and 1 flat sheet for draping. And the main goals of these activities are to ensure modesty, make sure the patient is comfortable and safe, and to allow easy access to the exposed area being treated.
Hi, I'm John Deere. I'll be your physical therapist today.
Hi, I'm JoJo Siwa, and I will also be your physical therapist today. Can I please have your name and date of birth?
Yeah, my name is Evie Lee Miller. My date of birth is June 2nd, 1960.
All right, can I just see that wristband real quick? All right, great. And just letting you know, we both washed our hands before starting this treatment today.
Addressing the patient's head position, what we want to do is we want to use the part in the table. So normally we could put a rolled up towel or a pillow in, but we're just trying to put the patient's C-spine in either neutral or some slight flexion. So for the purposes of today, we're just going to take this out because this is the most comfortable position for the patient. So, and then we would ask the patient to lie down. So making sure their head is in that spot. Then from there, we're going to move on to relieving stress on the shoulders. So what we're going to do is we're going to ask consent from the patient. Is it okay if we put a pillow underneath your shoulders?
Yes.
Awesome. So then we're just going to, so if you can lift up for us. Awesome. And then we're going to put a pillow underneath the shoulders, and this is just to reduce the stress on the scapulae muscles of the patient, and also you can either put your arms underneath your head or by your side, whichever you choose. Next, moving on to the pelvis, we're going to put a pillow underneath the patient's hips. Is it fine if we put a pillow underneath your hips?
Yes.
Awesome, thank you. So then we're just going to ask them to lift up a little bit, and we're going to put the pillow underneath the hips. And what we're doing here is we're really trying to focus on relieving stress from the bony prominences of the pelvis, and also we want to reduce the lordotic curve of the lumbar spine so we can put their spine in neutral and relieve stress. And then lastly, is it fine if we put a pillow underneath your ankles?
Yes.
Awesome. So then if you could just lift up your legs for us. Thank you. And then next, you're good to put them down. So next, what we're doing is we're putting the pillows underneath the ankles, and what this does is it allows us to relieve stress on the legs. But there is one caveat: you don't want to leave it in too long of a condition because we don't want to develop contracture of the hamstrings. And other than that, that's how you put pillows underneath the patient.
I have a clean sheet here for draping. The importance of draping is to help the patient feel comfortable and make sure that they're modest. Additionally, draping maintains a comfortable body temperature and helps protect the patient's clothing. Every patient has their own level of modesty, and it's important to be considerate of patients' wishes, including their cultural and religious preferences. Is it okay if I place this sheet over you?
Yes.
All right, so we would just be placing the sheet over our patient. And then since our patient has an ankle injury, we will want to make sure that the ankle is being shown. Is it okay if I move the sheet so your ankle is exposed?
Yes.
All right. Now we have a space to work on our patient. Are you comfortable?
I am.
All right, and that's draping.